President Uhuru lockdown puzzle and what is expected as D-Day nears. With the number of positive cases continuing to soar, the glimmer of hope so far is that the number of recoveries has been higher than that of those found with the virus every time the Ministry of Health releases its daily COVID-19 situation report. Those within the president's circle who are against locking down Kenya again are using this balance between daily infections and recoveries to push for inter-county borders to remain open while continuing with the phased reopening of the economy. On the flip side, those who want the country shut down again, including some governors, argue that the health system could be overrun in a matter of months unless the spread of the virus is contained. During a virtual meeting on Thursday, the governors disagreed on how to go about the lockdown, with some suggesting locking down the 3 counties of West Pokot, Baringo, and Samburu that have not registered cases yet and leaving the rest to their devices. This, they said, will prevent the virus from spreading to the counties. Governors from the said counties were not for the idea that their counties be locked. Others proposed a lockdown of Nairobi County, which is the hotspot of the virus and has led to the spread to other counties. Nairobi, being an economic hub for many, is hard to lock down, and because the infections are already here with us, we should now focus on how to prevent the virus from killing people rather than locking people who already have the virus from continuing with their business, said an official who attended the meeting. By Saturday evening, the option of a second lockdown was not on the cards yet, but things could change between Sunday and Monday when President Kenyatta is expected to meet with governors to assess the situation. The Ministry of Health Saturday hinted at closing down restaurants again since they are flouting the COVID-19 rules. Speaking during the COVID-19 briefing, Director of Public Health Francis Kuria warned that stern action will be taken against restaurants' owners. I do not know what will come out of tomorrow's meeting, but if the president decides to close them they should not complain because they asked for it, Dr. Kuria said. Kenya has recorded the highest number ever of COVID-19 cases with 960 new cases in the last 24 hours, raising the country's national tally to 17,603, Ministry of Health has announced. Some 952 were Kenyans and 8 were foreigners, with the youngest being a 1-year-old child. Nairobi was leading with 510 cases, followed by Kajiado, 102, Kiambu, 100, and Machakos, 58, and Mombasa, 48. The meeting between the head of state and governors will assess the county's preparedness to handle a spike in coronavirus infections and review the effects of lifting containment measures nearly 3 weeks ago. The meeting had initially been scheduled for last Friday but was postponed in order to allow the county executives time to agree on a common position on the pandemic. While a section of governors has demanded a second lockdown of Nairobi, another wants things to remain the way they are. Their argument is that the first lockdown did very little to stop the spread of the virus, and that the fatality rates are still too low. In any case, they say, the claim that our health systems will be overwhelmed has been debunked by the fact that close to 90% of the COVID-19 cases in Kenya are asymptomatic and do not require hospitalization. Unless things change between Sunday and Monday, sources close to the presidency told the nation that the government is highly considering introducing restrictions targeting specific areas. Experts, on the other hand, are against the lockdown, saying that it is not a solution to containing the virus. Amref Health Africa Group Chief Executive Officer Githinji Gitahi said the virus detected across the country is of the same strain, and that a lockdown would only work if there were different strains. One of the restrictions being considered in Monday's meeting is the total closure of bars and gyms and issuing of strict controls in the sale and consumption of alcohol. Nightclubs and restaurants have for the last 1 month found ways of circumventing the existing regulations during COVID-19 by allowing unrestricted sale of alcohol without adherence to social distancing rules. A draft legal notice by the Ministry of Health notes that no one should consume any alcoholic drink in public places, and these include parks, restaurants, parking lots, eateries, bars, entertainment joints, and supermarkets. Health Cabinet Secretary Mutahi Kagwe allowed restaurants to reopen in June so long as they closed by 7:30 p.m. He also said clients must observe social distancing measures, but this has scarcely been enforced in many instances. The Pubs, Entertainment and Restaurant Association of Kenya, PERUC, has argued that reintroducing tight regulations in the sector will result in about 500,000 job losses and loss of Sh50 billion in revenue. South Africa, which has one of the world's toughest lockdowns, including a total ban on the sale of alcohol and cigarettes, since March now ranks 5th globally among the worst hit countries by coronavirus, with over 364,000 cases. Cities like Beijing in China, Leicester in England and Melbourne in Australia were forced to reintroduce lockdowns after witnessing surges in coronavirus infections after easing restrictions. On the other hand, the governors were previously calling for a lockdown to arrest the rise in infections, a call that health experts dismissed, saying it was upon the county chiefs to manage cases as they arise. County bosses have thus concluded there would be no need to restrict the movement of people, especially into and out of Nairobi. Council of Governors Chairman Wycliffe Oparanya told The Star they want Nairobi left open as it is the hub of Kenya's economic activities. He said they will implore upon the President on the need to increase testing centres across the country. As such, the county chiefs seek to push for speedy disbursement of cash from the national treasury. The devolved units are yet to receive about 68 billion Kenya shillings of their allocation for the last financial year. Currently, no money is flowing to counties. How do they, National Treasury, expect counties to deal with these emergencies? What is critical is that we must increase testing centres. We have very few of them yet. Every county should have a testing centre, Oparanya said. Governors hold that by establishing the centres, there will be an opportunity to create awareness among residents. Counties will now be best placed to come up with ways of containing the disease. If we can enhance testing, it will alert us on how to contain the disease, Oparanya said. Governors also intend to engage the President on concerns about laxity in the enforcement of protocols by the Ministry of Health. Their concern is that the directives for social distancing, curfew, funeral attendance and other social gatherings are being abused. They said people openly disregard the protocols as police look away. Governors Mutahi Kihiga, Nyeri, Lee Kinyanjui, Nakuru, and Alfred Mdoa, Marcharcos, have been pushing for tougher conditions. Oparanya cited laxity in enforcing curfew and a trend where funerals, especially of those who don't die of COVID-19 hence not under focus, are being attended by more than 15 people, contrary to Health Ministry directives.